Good, happy Tuesday evening, December 22nd, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday evening, so let's begin. First up, New Hampshire COVID information, new updates and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 37,388 number of people in New Hampshire have tested positive for COVID-19. 17,947,644 number of people in the United States have tested positive. 656 number of deaths from COVID-19 in New Hampshire. 889 number of people who have been hospitalized with COVID-19 in New Hampshire. And 318,602 number of deaths from COVID-19 in the United States. Let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Manchester, 789. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 5948. Let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple, daily new positive COVID-19 cases. In the orange, new hospitalization, and red, deaths. Let's take a look at this chart here. Current cases in the purple, total current COVID-19 cases. In orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases. Orange, total hospitalization, red, deaths, and blue, recovered. Let's take a look at this chart here. Positive PCR test rate, positive PCR and antigen test rate, and daily PCR test. Let's take a look at this chart here, age group of cases and female and male of cases. And let's take a look at this chart here, infections, hospitalizations, and deaths. And let's take a look at this chart here, deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. COVID-19 hospitalizations rise as vaccines continue to be distributed in New Hampshire. Governor says no need for new restrictions at this time. Here's a look at your case updates. (624 new cases, 6,458 active cases, decrease of 203, 37,528 total cases, and 297 current hospitalizations. As more vaccines arrive in New Hampshire, case numbers and hospitalizations continue to grow, and health officials are urging Granite Staters to continue to take precautions to prevent the spread of COVID-19. State epidemiologist Dr. Benjamin Chan said the state's test positivity rate has been stable at a 9.1% average over the past 7 days. There were 624 new cases reported Tuesday, and the number of current hospitalizations is at a record of 297. Governor Chris Sununu said there is no need in New Hampshire to impose more restrictions, as Massachusetts is doing to try to address the surge in cases there. He said he expects the number of hospitalizations to continue to rise, but nothing has risen to the level of requiring return to more restrictions. No new deaths were announced Tuesday, but Sununu noted that hospitalizations and deaths tend to lag the case numbers. He said there is some sign that new cases are leveling off. Dr. Beth Daly, chief of the State Bureau of Infectious Disease Control, said more than 4,500 doses of the Pfizer vaccine has been distributed in the state. mostly to hospitals where frontline workers have been vaccinated. Over the weekend, the Moderna vaccine received an emergency use authorization. Daly said the state received more than 24,000 doses of the vaccine Tuesday, and about half of those will be distributed to hospitals, and about half will be used to launch state-run flexed vaccination sites, which will open December 29th. Those sites will be used to vaccinate high-risk health providers not in hospitals and first responders. The vaccine scheduled to begin organized with first responder agencies. Another 8,875 doses of the Pfizer vaccine are arriving this week. Daly said those will mostly be used to support the federal long-term care center vaccination program with pharmacies. United Way seeks volunteers to help COVID-19 vaccination sites. No medical training needed to help people get vaccinated. Let's take a listen to that video from WMUR News 9, Jessica Moran.
Earn your degree faster at Purdue University Global. With over 175 online programs, there's one for you. Start today with a 3-week risk-free trial. Apply now at purdueglobal.edu.
This is a way to make a difference in a way that might never, frankly, come up again.
The United Way of Greater Nashua is looking for volunteers to help people at COVID-19 vaccination sites.
If you're looking to make a difference in your community, this is a once-in-a-lifetime call to arms to support Greater Nashua in our efforts to stay healthy, safe, and strong.
No experience is required, and you won't be doing any medical work, but you will be helping in other ways.
Could be anything from traffic control to walking around with a clipboard, making sure people are registered.
Foreign language skills are also particularly helpful.
Nashua is a very diverse community, so in particular, Spanish and Portuguese are highly desirable languages. If somebody has those skills, that helps a lot.
In addition to helping vaccination sites run smoothly, the nonprofit is also delivering gift cards to hospital workers, and they're helping students with remote learning by handing out laptops and mobile hotspots. They also run pop-up mobile food pantries and more.
As of today, we've, for example, distributed almost 200,000 face masks in Greater Nashua through our efforts to keep our community safe. So lots of ways in which you can pitch in with the United Way to make a difference in our community.
And if you do want to volunteer, you will have to pass a background check. If you are a retired medical professional and you want to help, the United Way says they can help you get connected to one of the hospitals. Reporting live, Jessica Moran, WMUR News 9.
Okay, and there you go on that video and that report. New Hampshire members of Congress support and praise passage of COVID-19 relief bill. Shaheen, Hassan, Custer, Pappas joined big majorities in voting for passage of $2.3 trillion package that includes $900 billion for COVID-19 relief. After months of wrangling and partisan bickering, Congress finally passed a COVID-19 relief bill late Monday night, prompting the Trump administration to signal that President Donald Trump will sign the legislation into law. The $900 billion relief plan is part of a $2.3 trillion end-of-the-year spending bill to keep the government operating. The plan passed the House 359 to 53 and the Senate to 92 to 6. To address the raging pandemic, Congress includes $600 in direct payments to individuals and families, additional unemployment benefits, more small business aid, and funding for distribution of the COVID-19 vaccine. The 4 members of New Hampshire's all-Democrat congressional delegation joined big majorities in the House and Senate in backing the plan. Unlike the CARES Act passed earlier this year, the new bill does not include state-by-state set-asides and calls for the funds to be distributed according to programs and entities. And as a result, according to the state's 2 senators' office, it is unclear, at least for now, how much money New Hampshire or various entities and programs in the state can expect to receive. Each state received a minimum of $1.25 billion from the CARES Act passed in March. This relief can't get out the door fast enough, said Senator Jean Shaheen, who was involved in the development of a segment of the plan providing $325 billion for small businesses. She said she told the stories of struggling Granite Staters at the negotiation table. I believe it was their testimony and calls for action that moved the needling. We have more workers to do to help with long-term care recovery in our communities, but this emergency relief is critical to get through the difficult winter months ahead, Shaheen said. Granite Staters and all Americans are facing unprecedented challenges aimed at the pandemic, and this bipartisan package will bolster our public health efforts and provide vital relief to help individuals, small businesses, and schools make it through the winter, said Senator Maggie Hassan. I'm glad that our bipartisan group worked and helped to reach this compromise agreement. We know that our Constitution could not wait any longer for additional support. Hassan noted that the bills also contains a provision she co-authored and worked for 2 years to end surprise medical bills. The legislation was long overdue, said U.S. Rep. Annie Custer, and though it does not include everything we have been fighting for over the past month, the bipartisan legislation passed today will provide much-needed support for our healthcare systems, vaccine distribution capacity, increased funding for small businesses, and will extend unemployment benefits for Granite Staters who are out of work. Custer said several of her priorities were also included, such as funding for job-creating projects through the Northern Border Regional Commission, additional aid for small firms, and new housing support for low-income families and survivors of sexual violence. It's about time, added U.S. Rep. Chris Pappas. I'm pleased that we passed a bipartisan compromise package to get badly needed support to Granite Staters, but there is simply no reason it should have taken this long to act. No compromise is perfect, but this deal represents the important bridge to the new year, where we will have redoubled our efforts to address the pandemic and help those who continue to struggle, Pappas said. Two shelters opening in city with nearly 100 beds between them. The former Manchester police station is now operating as an emergency winter shelter that could house nearly 50 people and a second space with enough room for 43 more beds should be available by next week. And that does it for this Tuesday evening edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching. Have a great rest of your evening, and I'll see you back here tomorrow for another newscast. Good night and goodbye, everyone. I'll have a news report coming up in a little bit.